Hi, I'm Christine. I'm going to be doing a IV push furosemide injection for Miss Ellen Davis. So first I'm going to wash my hands. And I'm going to take a look at our order. It is furosemide 20 milligrams, IV push over 2 minutes now. And it's a PR medication because she's having symptoms of fluid volume overload and a 3-pound weight gain over 24 hours. So we have pulled our medication, and it is furosemide 10 milligrams per ml. So since we're giving 20 milligrams, we're going to be pulling 2 mLs from this. There are no particles in this vial. So once we pull the medication, we'll be able to see it a little bit better. We're going to check our expiration. It's 10/29. So we've got a 3 ml syringe. And then we also have a 25 gauge, 5/8 of an inch. For video purposes, this is the only needle I have, and if I was to be pulling up a medication, I would use a filter needle or a blunt needle just to enhance safety for it. So we are going to go ahead and scrub the hub. We'll scrub the vial. 6, 7, 8. Okay, we did that for 15 seconds. So we are going to get our needle out. We are going to pull back 2 mLs of air, inject that into the vial. Now we're going to draw up our 2 mLs. Okay, we want to make sure we get all our air bubbles out. Perfect. Okay. And we are going to recap our needle using the scoop method. Okay. So now that we've drawn up our medication, we're going to double check. It says furosemide 20 milligrams over 2 minutes. IV push, Miss Ellen Davis, and the time now. So for our vial, it says furosemide 10 milligrams per ml, so 2 mLs. We're going to be doing IV push, Miss Ellen Davis. Okay. So it doesn't look like Miss Ellen Davis has a allergy to this. We'll verify that once we get in that room. So we have a label made that states the medication, the dose, the time, the patient, and the birthday, so we can verify that. We're going to attach that to our syringe. And so before we actually give the medication, we have to flush it with normal saline, 3 mLs, before and after. So I have 3 ml flushes, normal saline already, that were already prepared. So I've got these taken care of. And so now we're actually going to go and see Miss Ellen Davis. Hi, Miss Ellen Davis. I'm Christine. I'm going to be giving you a furosemide IV push injection. This is just going to kind of pull some fluid off of you since you're having some fluid volume overload symptoms. Can you verify your name and your birthday for me? Perfect. And it says you have no known allergies. Is that correct? Perfect. Alrighty. So I'm going to wash my hands. And I would have washed my hands before I went to the room, but I'm just going to double check that and make sure my hands are clean. And I'm going to verify this order once again before I actually get the medication. So we've got furosemide at 20 milligrams, IV push over 2 minutes, time now, Miss Ellen Davis. This is Miss Ellen Davis. Okay, and in our vial it is 10 milligrams per ml. So we're doing 2 mLs, IV push. And that also correlates with our vial right here. Okay, and we've got our syringes right here, 3 mLs, 3 mLs. Okay, so I am now going to put on my gloves. Alrighty, I'm going to palpate your IV, make sure you don't have any tenderness or pain. Is there any? No, perfect. There are no signs of inflammation or phlebitis or infiltration. Seems perfect. Alrighty. So first thing that we're going to do is we're going to flush with 3 mLs of normal saline. We're going to scrub this hub for 15 seconds. Okay. And we are going to flush it. We're going to aspirate. There's blood return. Okay. And we're going to flush our 3 mLs. Perfect. Okay. Now we are going to take a alcohol swab, scrub this hub again for 15 seconds. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. We're going to take this needle off, twist it off, and put it in the sharps container. Okay, we'll scrub this hub again. Make sure it's extra clean. Okay. I'm going to start injecting it. It's going to take over 2 minutes. Okay. So since it's going over 2 minutes, we've got 2 mLs. We're going to be doing 1 ml per minute. Are you still doing okay, Miss Davis? Perfect. Okay. We're at the 1 ml mark. The medication has been given. Disregard that. So next we are going to flush with our 3 ml syringe. And since there's medication in this line, we do want to push it a little bit more slower than what we were. So we're going to scrub this for 15 seconds. Okay. So then if we had a light blue cap, we would put that on there, saline locker. Okay. I'm just going to fill your IV, make sure there's no infiltration signs or phlebitis signs. How does everything feel okay? Perfect. Take off my gloves, perform hand hygiene. Is there anything else I can do for you, Miss Davis? No, perfect. So then I would go and I would then document everything.